Hello, I'm Roberta Chadis, and you're watching Dog Health News, and this is a good place to come for dog health strategies to keep your dog well. Today, we're very, very lucky to have a guest, and actually two guests. We have Dr. Ilan Amar, my chiropractor. Thank you so much for coming.
Thank you for having me, Roberta. I appreciate it.
It's no problem at all, especially when you bring a charming guest, and this is Stella.
Hi, Stella. Say hi. Say
hello to the audience.
Thank you for having us.
Yeah. So we'll be talking a little more about Stella in just a moment. And what I'd like to do is introduce you to Dr. Amar and also let you know how he got into the chiropractic business, because being a patient, I know how much work it is. I know when you come in to an office and you're in pain, you really need help. And I know you're working all day long. So tell us a little bit about your practice in Swampscott.
Okay, my practice is in Swampscott. I've been there for 8 years. I got into chiropractic because I had headaches. And, you know, I just took a bunch of aspirin my whole life. I didn't know, my mom grew up in the, medicine cabinet, and I grew up in the medicine cabinet. And went to a chiropractor. He helped me with my headaches. Little did I know that some of my stomach pains and things like that went away also. So got into chiropractic and practiced in Arizona for 5 years, and I've been here for 8 years, and we've been able to help a lot of people.
Excellent. And what type of training do you really have to do to become a chiropractor?
That's a great question, Roberta. A lot of people think chiropractors go to school for 6 months. It's like massage therapy. But it is pretty much like a medical school. You go to school for about 8 years. So it's 4 years undergraduate, 4 years graduate school. It's very hard. I tell people if I was to do it again, I probably wouldn't go through it. But yeah, it definitely pays off. We do a lot of radiology, neurology, diagnosis, things like that.
And I know we're talking about the human aspect of chiropractic work, because I think it's good to understand that before we talk about how that applies to dogs. So the physical aspect, I know when I come into your office, you do certain things and you're doing it for everyone. So that makes your day pretty long. What does that do to you, and how do you handle that?
It could be very arduous, especially seeing a lot of people, a lot of big people, little big strong guys. So I have to keep in shape myself. So I like to do core strengthening, yoga, keeps me flexible, some weight training to keep me strong so I don't get injured, because as you know, I can't take a day off. That's true.
That's true. People are in pain every day. And I think it's time for us to talk a little bit about Stella.
Excellent.
What do you think?
Great. She loves it. She loves the attention. So Stella comes to the office every Wednesday, and it seems that that's when all the patients want to come in on a Wednesday so they can see Stella.
Of course.
And she's a 4-month-old Maltipoo, and she's very, very lovely. And she's a Bruins fan, as you can see. She likes the Bruins. And
Stella, you want to come in?
Yeah, come.
Well, Dad.
Come with Miss Roberta.
Okay. Over here. Great. So Stella is obviously a puppy. And what are some of the issues with puppies that might affect chiropractic work?
Well, I think a lot of people don't understand chiropractic so much. It's a very simple concept. You know, even Hippocrates at the turn of the, right around 60 AD said, look to the spine for the requisite of disease. Even in the pyramid days, they had people stepping on people's spine. So the spine really controls the whole body. If the spine's not in alignment, the body's not going to work the way it needs to. And so whether it's a puppy, a cat, a human, there's a spine involved.
And when we talk about the spine, that's right along from the neck
all the way down to
all the way
the
down.
End. And the nerves come and they go to the different organs, and they supply different organs with nerves. The nerves are nourishment for those organ systems. And so a chiropractor, it's pretty, you know, to make things, to simplify things, you know, this is not as healthy as this. And so if someone is like this, their body's not going to be able to work as good as it is if it's straight. And so what chiropractor does is we align the spine, whether it be a puppy or whether it be a human, so that the body can work to its maximal potential.
Now, am I sitting straight?
Yes, you've been getting adjusted recently.
I have. You made me, even just by talking about it, you made me sit up straighter. And actually, right away I was thinking about how we walk our dogs. And that's for us as a person, what our posture is like. And also the dog. I know my golden retriever, I felt like she was walking at an angle.
Oftentimes humans, like you'll see even in the mall, walking in the mall, I'll be watching and I'll see someone's hip kind of off on one side and they'll be leaning on one side. Same thing with dogs. Sometimes their hip is a little off and you'll see them leaning to one side. So they could easily, you know, go in to get a chiropractic alignment or an adjustment. And I think also if the owner is aligned, they're going to be less apt to get injured if it's a big dog and they're pulling the dog. Pulling the owner. So I think that's it's important for them to get adjusted to. And she loves you. Well,
that's good because I love Stella too. She seems to be very comfortable here. I might not give her up.
Oh, that's okay.
It's okay. So all of these things that I'm thinking about relate to people and animals. And I really would love to understand the concept of pain. People come into your office because they can describe what their pain is. Now, is that accurate? Do you find that they're telling you exactly what's wrong?
It is true. Nowadays, some people come in because they want to be healthy. It's not necessarily that they're in pain, but oftentimes I'd say the majority of people do come in from pain, whether it's low back pain, which is probably the #1 reason, headaches, you know, shoulder pain, neck pain, things like that. That's probably the #1 reason that they do come in. And you're right, a human can say, it hurts here, it hurts in my low back, it hurts when I cough, it hurts when I lift. Dogs really aren't going to do that. But when you do touch a tender spot on a dog or an animal, they will let you know right away.
I bet.
So.
And I know you told me a little story about Stella falling.
I did. Unfortunately, we were on the bed playing, and she misjudged where she was, and she fell off the bed. And she let out a big cry, and I thought she just kind of knocked the wind out of her. Unfortunately, she couldn't walk. I believe her left rear hind leg was slightly dislocated, maybe subluxated, which is a little less than a dislocation, and she couldn't walk. So I immediately just grabbed the leg and it made a small little adjustment, heard a little bit of an alignment, a little pop, and within about an hour and a half, 2 hours, she was able to walk.
You know, it's interesting because when you think about a puppy, they're very fragile. You know, these little bones are it's easy to break.
Yeah, her legs are very small.
So you have to be really, really careful, and this is important with kids in the house, especially because we are all playing with the puppy and other dogs, of course, older dogs, but they really they do have bones. They're not just all fur. And any advice on that? And we can parallel that to people as well.
Well, I do think like sometimes we have like one child that comes in the office that plays with her a little bit rough, and she is much more apt to get hurt than a bigger dog. So you'd have to watch for that. You know, obviously a broken bone is much more severe than a dislocation. So I would say you have to really, really be careful and watch out. We can't step on her paws because you know, it might be able to. They could easily break. So more awareness, I think, more awareness of what's around you, your surroundings, things like that is very important.
Absolutely. Now, I know that you don't really take dogs in for chiropractic work, but perhaps there might be a suggestion for our audience if they think that their dog might benefit.
So Stella gets a chiropractic adjustment weekly from me, and it just keeps her healthy, keeps her maintained. So as she's a puppy, she's going to grow up and she's going to be a healthy dog. She doesn't have any pain except for that one time she fell. I would recommend people going into an animal chiropractor and getting adjustments regularly. In my office, we don't accept animals only because we have a very busy practice with humans, and I would have to kind of do it a separate day. but there are plenty of chiropractors out there that will help with animals, and I would highly recommend going that route. I mean, people are, you know, sick and tired of feeling sick and tired, so are dogs.
Yes.
They don't want to take a bunch of pills and things like that. They want to, you know, eat good and move good and be healthy.
Speaking of pills, I love to know more about things that can help me. People with arthritis, people who have chronic pain. What type of supplements do you think really work and complement your work?
Well, so for like arthritis you mentioned, or inflammation, an omega-3 fish oil would decrease inflammation significantly. In fact, the studies show that it works better than aspirin and NSAIDs and things like that. So I'd highly recommend that. Turmeric has been shown to decrease inflammation. And it's not just about decreasing inflammation, as it's about avoiding inflammation. So some of the inflammatory responses could be gluten, dairy. These things can create a lot of inflammation. And so if you remove some of those, maybe some dairy, gluten, and then add some anti-inflammation, now you're way ahead of the game.
Now that is a very interesting point, because sometimes we look at how do we fix the problem? We're in pain. How do we fix that inflammation? But it's really, how do we not get ourselves into that position? And I'm curious, you mentioned a few types of foods. Are there other types of foods that can cause inflammation?
Yeah, like red meats can cause some inflammation, especially if there's if they're not grass-fed. So you may have some hormones, things like that in the meats that can cause some inflammation. Those have been known to cause inflammation. Sugar is another inflammatory cause right there. So that's very difficult, but removing sugar will decrease inflammation. So it's really not about doing it all at once, but gradual. And I think if people do it gradually, they'll start to feel better and they'll start to feel healthier, and they're not going to want to intake those foods that create inflammation.
Very interesting. So back to the spine and being aligned. My situation was I felt I didn't have good range of motion on my left shoulder. And there were various other things that I don't need to describe about me. But I know the concept of insoles to keep us aligned. What do you feel about those?
Well, we do custom orthotics in the office, and that's just an insole that's customized based upon your imprint of your foot. And really everything does start from the ground up. So if the foot is off, then everything, the knee's going to be off and the hip's going to be off. But if the foundation is strong and straight, everything else is going to be straight. So we really like to start from the feet down. In our office we do a lot of diagnostics. We have a machine that detects any how your nerves are functioning, how the muscles are functioning, if they're pulling out more on one side than the other. So we try to keep you in balance. And also some digital x-rays to show your posture and your spine. See if there's any scoliosis, if there's high hips, things like that. So we do a really diagnostic evaluation on the first day, and from there we do a customized treatment plan for that individual based upon those.
Interesting. And also, I'm just thinking about the experience in the office when you come in to see a chiropractor, and I'm sure it's the same for animals or similar. There's always the heat application and that other machine that kind of jiggles you up. I'd love to hear a little more about that. So in our office we do like electric stimulation and some heat to if needed, so that the patient can relax and it can loosen up some of the muscles to make for an easy adjustment. Normally with dogs there isn't that, and so there's different type of adjusting techniques that we do in the office. We have a little device that's looks like almost like a gun, and it puts an impulse into the spine very lightly and gently, so that things can become in alignment. We also use our hands, which is the cause of is the nature of chiropractic. Chiropractic means done by hand. So we do that in the office, and just like anything, a dog would have an intake form. They would find out what it's eating, how much it's exercising, right? How much love it's getting. Is it alone a lot during the day? Things like that. So very similar. It's just just different type of patient. And can you believe
She is
how
amazing.
Little Stella is just adjusting to being on television? What do you think?
She loves you. Yep, I think she's
adorable.
She's born to do this.
She really is very, very sweet. I would also love to know what you're doing to communicate to people like our audience and outside of your office, because I know you do some speaking and do some events, so I'd love to hear about that.
Okay. Well, we do health talks every 2 weeks in our office, and we teach people how to eat well, move well, and think well. And a lot of times people have no idea what is wellness. They see wellness spa, they see wellness, you know, nutrition food place down the street, and it's really not wellness. So people are very, very confused, yet they want wellness. So we're teaching people how humans are genetically programmed to eat, move, and think. So every 2 weeks we have a different program. One's Eat Well, which seems to be the most popular because everybody wants to know, what do I eat? One's Move Well, you know, how much should I exercise? What should I do? And one's Think Well. Well, how do I reduce stress levels, which is the #1 cause of really illness in society right now. So we teach people how to do that. You know, if they do that, eat well, move well, think well, at the same time, for a period of time, they'll be healthy.
That is great. Now, what do you think people eat that is not really good for them?
Well, I think a lot of times in our society right now, people are eating a lot of sugar, and they don't really know, and it's very addictive. Sugar is very addictive, and so it's very hard for them to come off it. And so, you know, you have to understand it's just like an addiction. I mean, if someone, you know, has alcoholism and it's an addiction. If someone has, you know, they're eating a lot of sugar and they're trying to stop, it's very difficult. And so we don't want to, you know, sometimes the best thing isn't just to shut it off, because the body's going to go into almost like a withdrawal, like, you know, symptoms, depression, things like that. So we try and teach people how to eat good before eating bad, which is very important. And really just make it a gradual thing, and have like a coach, a health coach. I consider myself more of a health coach, life coach type of thing, but there's plenty of people out there that do that, especially nowadays. So if someone needs help, reach out, grab somebody. People are much, at this point, willing to help people.
That is great. And exercising, I'm always in amazement at these people who run marathons, and they're out there in all different kinds of weather, running. What does that do to people's bodies?
Well, you know, fortunately, people are doing more Spartan races and triathlons and running. It does do a number on the body, especially running on asphalt, but most of those people actually do other things to complement their running style. So they'll do chiropractic. We see a lot of athletes in our office. They'll do massage therapy. They'll do acupuncture. They'll do yoga to keep flexible and keep strong. So they'll do these things to complement that.
That's true. I remember you were recommending yoga as a good backup when I'm not doing something else. So that's really great.
Yoga goes hand in hand with chiropractic.
Yes. And for dogs,
yes,
they can also do some stretching.
Yes.
Right?
She does a great down dog daily with her mother, who's a yoga instructor. And I think that when Erica is doing some yoga on the ground, she'll start to lick her and start to play and do some, you know, you'll see her doing some stretches. So I actually recommend that. I think if nowadays people can go on demand for free, do a yoga program, have their dogs doing, you know, kissing them and things around, and make it a little fun. I think it would be good for both people, both the dog and the person.
Excellent, excellent program. And I'm thinking about all the work that you're doing. Do you also get some treatments to keep you in shape?
I do. I take weekly chiropractic adjustments, weekly or every twice a month. I get massage, acupuncture, very important. I try and do yoga a couple times a week, and I try to go to the gym another 3 or 4 days a week to keep healthy. It's very, very important.
So what is the difference between acupuncture and chiropractic work? I know a lot of people ask that question.
Well, so chiropractic deals with the spine and the central nervous system, And acupuncture deals with a meridian system, which is an energetic system that's around. And it's difficult to explain, but think of it if you wanted to listen to, let's say, 94.5, and your radio was on 94.1, it wouldn't come in that good. Well, they can fine-tune certain points. It doesn't have to be with needle, it could be with laser, and basically bring it up to 94.5 so the body works better, so the organ system works better. It's just another form to keep healthy.
Excellent. It's sort of like listening to music.
Yes.
You're kind of going one way or the other. Now, I know we've talked about a lot of tips for our audience, but I'm thinking maybe we should share with our audience a little bit of guidelines, just a couple of different guidelines to keep yourself aligned when you're not with the chiropractor, and what kind of...
Well, if you haven't been to a chiropractor, the first thing I would say is at least, most of the time it's covered by insurance, and at least you can make an appointment and get in.
Mm-hmm.
And then I would also recommend just being consciously aware of being straight. Most people know. And unfortunately, sitting is to the spine as sugar is to the teeth. So we sit a lot, and if we can sit less, and if you have a job that you have to sit all day, get up and stretch, every 30 minutes. Very, very important. Try to go for a walk, because the more you sit, the more the spine starts to decay and degenerate. The more you stand and move, the better it is for your body.
Excellent. And what if you're standing a lot?
Well, the same. It's actually better to stand more than it is to sit, but you could rest here and there if you had a job that you were on your feet all day.
Now, I've noticed with dogs, they sleep a lot, so they're in a resting position, and then they're running a lot. Would there be any guidelines you would like to give for exercise with your animals?
Well, I think it's just as important, if not more important, because they're used to even exercising and running more. You have to think the way they've evolved. Really, unfortunately, the only thing really sicker than humans in this country are really domesticated animals, because they, just like us, aren't eating what we're supposed to eat or moving like we're supposed to move. So if we can get them to move more and exercise more, they're going to be more happy, and the owner's going to be more happy.
Very interesting. And I know you've actually talked to me about the different things about food and what we eat versus what our animals are eating. Those potato chips. No, what do we give our dogs for treats? What shouldn't we do?
Well, again, I'm not a veterinarian, but I did have to speak to some veterinarians on what they're supposed to eat and what we're supposed to eat. And just like humans, raw food from the earth and things like that is going to be best. Less, if not zero, processed foods. Same with animals. If we can get them to eat, raw foods from the earth like they're supposed to, like they're genetically programmed to, they're going to be much healthier. The more you go with processed foods, just like humans, the less healthy we are.
Right. So this is really interesting, because sometimes we think we're being kind to our dogs who are begging for things from the table, but it's really unhealthy, and it affects their bones and their nervous system. I know you talk about sugar. It doesn't look like sugar, but bread turns to sugar. So giving a dog pizza, not a good thing.
Highly not recommended. They may want it at the time, but it's not really healthy for them. And they'll eat much healthier treats. I think they would prefer some, raw hamburger or something more than the pizza anyway.
I think so. I think Stella is turning into a movie star here.
I do think so. She's looking right into the camera.
She is just having the best time.
What she's thinking. She's like, who is that?
I don't know. I can feel her heart beating, and I am thinking about the nervous system of the dog versus mine. I'm sitting here straight, and I'm wondering what is happening that's new in your business. What types of things are you adding or taking away?
Yeah, in our business, we actually just added massage therapy, therapeutic massage therapy, which we go in with the massage therapist. They look at different scans on the nervous system, on the muscular system, the x-rays itself to see if there's a scoliosis or muscles pulling on one side more than the other. So we added therapeutic massage therapy to the office, and we also added acupuncture to the office so that we can kind of have a one-stop shop. We have a chiropractic there also, been there for 8 years, but I was referring people out to different therapists, some acupuncturists, and I wasn't getting the results. They were coming back with not the best results. So I said, well, why don't we just keep it in-house, get the best therapists, and help them the most that we can. So we just added that recently within the last couple of weeks. And yeah, we're looking forward to 2015 and helping more people.
That is great. And how do people get in touch with you, Ilan?
Well, I think not Facebook, please. Unfortunately, I get a lot of Facebook messages. I'd like to come in at 2, and meanwhile I'm working on patients. I don't get it till the next day. The easiest way, if people like to do, can pick up the phone. If they're a phone type of person, just call 781-592-7600. Nancy or Alicia will answer the phone and get them in as soon as they can, as early as possible. And if they want to go on a website, if that's the easiest, sometimes people are on the mobile website. Our app is actually, our website is actually mobile, so they can do it right from their phone. And you can schedule an appointment. A lot of times people do that nowadays. They can go to www.dramar.com, doctoramar.com. That might be easier for them too. And those methods would be the best way for them to get in touch with the office staff and come in.
That's great. And if someone does have a question about their dog, do you mind getting a phone call?
Not at all.
No?
Not at all. We'll always, people actually do, sometimes some of the patients come in, hey, listen, my dog's not walking properly, can I bring them in? Yes, we'll let them come in the office.
That would be
Of course,
great.
if they have any questions, I'd be more than willing to help them out.
Well, I think Stella wants to at least say hello to the audience there. She
Say hi,
is,
Stella.
I don't know if I'm going to give up this dog.
I know, it's going to be tough to get her back.
She is just precious, and I know that you have lots to do today, but I want to thank you so much for being on Dog Health News.
Thank you very much for having Stella and I.
And I hope, I think I'll see you next week.
Excellent, thank you.
All right, thank you.
Thank you for having me.
And thanks to our audience, we'll have more good information coming your way. So thank you so much for watching Dog Health News. I'm Roberta Chadis.